Greetings from my YouTube channel again. We're going to talk about the possible hazards of ginger today. Although ginger is well known across the world for its many health advantages, including its ability to ease nausea and aid with digestion, it's vital to understand that there are some circumstances in which ginger may not be appropriate. Although the medicinal qualities of this potent root have been prized for generations, there are times when prudence is required. We'll discuss the situations in which using ginger might not be the healthiest course of action in this video, enabling you to use it wisely. You may be confident that all of the material on this page has been objectively examined, well-researched, and approved by licensed health experts. Now let us begin with the 9 reasons why ginger is bad ***. Consuming ginger is one area in which you should exercise extra caution when it comes to your diet if you have a bleeding disease or are prone to excessive bleeding. Because of its reputation for thinned blood, ginger may be helpful in some circumstances, but it can also be dangerous for those with bleeding issues. It has been discovered that the active ingredients in ginger, specifically gingerol and ***, have antiplatelet and anticoagulant qualities. Prolonged bleeding may result from these components interfering with the body's normal blood clotting processes. Ginger, in any dosage, has the potential to exacerbate bleeding issues in people. Prolonged bleeding or clotting problems might pose major health hazards. Because of this, it's imperative that people with certain diseases consult a doctor before introducing ginger into their regular regimen. A medical expert can evaluate the patient's health history, determine how severe the bleeding issue is, and offer personalized guidance on whether or not ginger is a good addition to the diet. For people on blood-thinning medications such as aspirin or warfarin, this is especially crucial. The risk of bleeding problems may be considerably increased when ginger is taken with these drugs. Ginger should also be avoided by anyone having surgery in the days preceding the procedure, in order to reduce the risk of problems. In conclusion, even if ginger is a useful spice with a wide range of health advantages, people who have bleeding disorders in particular should not ignore its effect on blood clotting. Knowing these dangers will enable you to use ginger wisely and take advantage of its health benefits without running any risks to your health. A crucial component of treating diabetes for those who have it is keeping an eye on their food choices. Ginger is one food that needs to be chosen carefully. Although ginger is highly regarded for its possible health advantages, including its ability to lower inflammation and ease digestive problems, diabetics may be particularly at risk from ginger's effects on blood sugar and blood coagulation. The possibility that ginger may lower blood sugar levels is among the most crucial things diabetics should think about. This may be advantageous as well as potentially dangerous for people who already have trouble keeping their blood sugar levels stable. Although modest use of ginger may help stabilize blood sugar in some situations, it can also result in a sudden drop in blood sugar known as hypoglycemia, especially for individuals taking insulin or other treatments meant to lower blood sugar levels. Hypoglycemia manifests as weakness, perspiration, dizziness, disorientation, and in extreme situations, fainting or losing consciousness. These drops have the potential to be harmful and may conflict with the person's overall diabetes treatment strategy. Additionally, because ginger contains substances like gingerol, which might improve circulation by preventing platelet aggregation, ginger has natural blood-thinning properties For those without underlying medical concerns, this might be advantageous, but it can be problematic for diabetics. Due to their increased risk of blood clotting issues, many diabetics may already be taking aspirin or other blood thinners. Using blood-thinning drugs with ginger may make bleeding more likely and make it more difficult for the body to heal from small cuts or wounds. This is especially important for diabetics, as impaired circulation, especially in the extremities, increases the risk of infection and frequently results in slower healing rates. Digestive problems are another potential risk that diabetics should be mindful of while ingesting ginger. The stimulant properties of ginger are known to aid some people, but they can also cause discomfort, bloating, or gastrointestinal upset in other people. Digestive disturbances are not only annoying for diabetics, but they can also have an impact on blood sugar levels. The overall treatment of the condition may become more difficult when there is disruption to the digestive system, making it harder to forecast or control blood sugar levels. As a result, before including ginger into their diet on a regular basis, diabetics must closely check their intake and speak with their healthcare experts. Personalized guidance on the proper amount of ginger, if any, can be provided by a healthcare practitioner, taking into account the patient's medical history, current medications, and overall diabetes management regimen. Ginger has certain advantages, such as anti-inflammatory properties that may help control other diabetic issues, including neuropathy. But it's important to pay attention to its effect on blood sugar levels and blood clotting. Diabetics must weigh the possible advantages against the hazards in order to avoid unintentionally impairing their blood sugar regulation or raising their risk of bleeding problems. In conclusion, even though ginger is praised for its healing properties, people with diabetes should not always choose it. Diabetes sufferers can minimize the hazards associated with ginger use and still reap its potential advantages with careful thought and professional guidance, ensuring that their health is properly maintained. Ginger use needs to be done with special caution in those who are managing cardiac issues because of its possible impact on cardiovascular health. The power of ginger to increase overall blood flow and enhance blood circulation is well known. Many people may benefit from this, but those who already have cardiac problems may be at danger. Because of ginger's stimulating effects on blood flow persons who already have cardiac problems may have worsening symptoms. And higher heart rate might cause further concerns, such as elevated blood pressure, arrhythmias, or other negative cardiovascular effects, for someone who already has an irregular heartbeat or other cardiovascular issues. Furthermore, one of the main reasons why persons with heart issues should use ginger with caution is because of its inherent blood-thinning effects. Blood thinning can assist reduce clot formation, which might be advantageous for patients at risk of stroke or heart attack. But ginger can increase the blood-thinning impact for people currently on anticoagulant medications, such as heparin, warfarin, or aspirin. This may result in excessive bleeding, easily bruised areas, or in more serious situations, internal bleeding. Blood-thinning drugs are frequently administered to patients with heart problems as part of their treatment regimen. Taking ginger in addition to these drugs may greatly raise the chance of these harmful side effects. It's also crucial to remember that consuming ginger should be avoided by those who have high or low blood pressure. Unpredictable variations in blood pressure could destabilize the condition of those with cardiac issues, even though ginger is proven to help lower blood pressure in some circumstances. An unanticipated decrease or increase in blood pressure may exacerbate their symptoms or cause problems with their current course of treatment. In conclusion, while some people may benefit from some heart-healthy properties of ginger, those who already have cardiac issues should exercise caution when using it. It's crucial to speak with a doctor before adding ginger to a diet, especially for those using heart medication, in order to prevent problems and guarantee general safety. Ginger has long been known for its many health advantages, such as improving inflammation, lowering nausea, and facilitating digestion. While many people find these qualities beneficial, others who are trying to achieve or keep a healthy weight may find them difficult to work with. Understanding these obstacles is vital for anyone working with underweight concerns, since ginger's natural qualities can unwittingly compound their efforts. Ginger's potential to stimulate the digestive system is one of the main issues with its ingestion for underweight people. Digestive enzymes are produced more frequently when ginger is used, which helps facilitate better digestion and nutrient absorption. As advantageous as this may sound, it can also result in a faster metabolism. A higher metabolic rate may be detrimental to people who are already having trouble gaining weight. It may be more difficult to consume the number of calories required for good weight management if a faster metabolism causes calories to be burned more quickly than they can be ingested. Ginger has also been shown to have the ability to suppress appetite. While cutting back on cravings or unhealthy snacking may benefit those trying to control their weight, it may make the difficulties underweight people encounter more severe. A decrease in appetite may result in less food being consumed, which can make weight problems worse. This is especially worrying for people who might already have low appetites as a result of underlying medical issues or other circumstances. Consequently, ginger consumption should be used with caution by those who struggle with underweight, as it may interfere with efforts to improve calorie intake. Given these worries, people who struggle with underweight should get individualized nutritional advice from a certified dietitian or healthcare provider. These experts can offer customized advice on how to reach a healthy weight while taking food choices and unique health requirements into account. They can offer tips on how to up calorie efficiently without sacrificing general health. Furthermore, although ginger is a helpful herb in many situations, underweight people might need to look into other choices in order to effectively manage their weight. Including foods high in energy. Including avocados, nuts, seeds, and healthy oils, might assist them in consuming more calories. These nutrient-dense meals help meet energy needs without requiring a lot of food, which could be too much for someone who isn't feeling very hungry. Moving on to ginger eating during pregnancy. Let's talk about another crucial factor. More people are turning to ginger as a morning sickness and nausea treatment, especially in the first trimester of pregnancy. However, there are possible hazards connected with ingesting excessive dosages of ginger during this sensitive time. Excessive use of ginger may raise the risk of miscarriage, according to several research, especially during the early stages of pregnancy when the risk is relatively higher. As a result, it is wise for expectant mothers to err on the side of caution and limit their consumption of ginger during these vital weeks. Moreover, there are further worries regarding ginger's potential to function as a natural blood thinner. This characteristic may affect the blood's ability to clot, which could cause issues with birthing or any associated medical treatments. Increased bleeding after giving birth or during the postpartum period might pose serious problems, making healing and general health more difficult. Expectant moms should be informed of these dangers and think about how consuming ginger can impact their unique health circumstances and delivery plan. Apart from these factors, ingesting ginger could cause gastrointestinal distress in expectant mothers. While ginger is frequently used to treat nausea, it can also cause other problems, such as bloating or heartburn, especially in pregnant women who are predisposed to gastrointestinal trouble. For many women, this kind of discomfort can make an already difficult situation even more difficult. It is highly advised that expectant mothers speak with a healthcare professional before including ginger into their diet due to these possible risks. A medical practitioner can offer advice specific to the patient's health history and stage of pregnancy. They can assist expecting moms in making educated dietary decisions by weighing the possible advantages of ginger against the hazards involved. In conclusion, even though many people find that ginger is a beneficial complement to a balanced diet, its use during pregnancy and for people who are concerned about their weight should be done so carefully and mindfully. Through moderation in ginger usage and regular meetings with healthcare practitioners, people can greatly lower the hazards connected with ginger consumption. Expectant moms can effectively address weight management difficulties while also protecting their own and their developing child's health by remaining aware and mindful. Asterisk hypotension or low blood pressure can cause a number of health issues such as weariness, lightheadedness, and dizziness. Ginger's natural qualities can make low blood pressure symptoms worse for people who already struggle with them. Therefore, eating ginger should be done with caution. The special effects of ginger on the body are attributed to its active ingredients, namely **gingerol** and **zerumbone. These substances dilate blood vessels by acting as **vasodilators**. This broadening may cause blood pressure to decrease significantly, which could exacerbate hypertension symptoms. Ginger not only dilates blood vessels, but also promotes the synthesis of **serotonin** and **norepinephrine**, among other hormones and neurotransmitters. Although these substances are essential for many body processes, their effects on blood pressure may be harmful to people who already have problems with low blood pressure. In people who are predisposed to abrupt reductions in blood pressure, the stimulation of these neurotransmitters may further lower blood pressure, increasing the risk of dizziness or fainting episodes. When talking about ginger eating, it's important to take into account any potential effects on surgical procedures. It's important to be aware of which meals and supplements can affect how the body reacts to anesthesia and other medications used during surgery when getting ready for surgery. Ginger is one such drug that could heighten the risk of excessive bleeding during surgical procedures. Ginger thins the blood, which can make surgery more difficult and raise the risk of problems after surgery. This is particularly concerning for those with pre-existing bleeding issues or those currently on anticoagulant drugs. Ginger may also have an impact on blood sugar levels, which presents a unique problem for diabetics. Because of its innate blood sugar-lowering properties, it may conflict with normal insulin administration, causing blood glucose levels to fluctuate during the surgery. Sustaining steady blood sugar levels is essential to a successful surgical procedure and facilitating a seamless recuperation. Before having any kind of ginger tea, supplement, or food item, patients are usually advised by medical professionals to wait at least 1 week before having any kind of ginger surgery. By taking this preventative measure, the patient will be as safe and well-adjusted as possible during the entire surgical procedure, as ginger may have an effect on blood coagulation and blood sugar regulation. In conclusion, even though ginger has many health advantages, people with low blood pressure and those getting ready for surgery should use it with caution. Before adding ginger to the diet, it is best to speak with a healthcare provider, especially if you have any of these particular health issues. People may make educated food decisions that put their health and safety first by being aware of the possible hazards and adopting the necessary safety measures. To sum up, ginger is a multi-purpose spice with a long list of health advantages. However, it is vital to understand conditions where its ingestion may not be advised. It is imperative that you speak with a healthcare provider before adding ginger to your diet if you can relate to any of the problems raised. By taking this careful approach, you can benefit from ginger's benefits without running any health risks. If you thought this video was educational, please subscribe to our channel and leave a like for more insightful videos. We appreciate you watching, and our main priority are your health and well-being.